Hi, I'm Hannah, one of the physical therapists at the Student Health Center at the University of Oregon. You might have seen me already. We're doing a series of educational videos on how to keep yourself healthy and active while your lives are a little different and not on campus right now. Over the series of videos, you're going to see me in a mask. Obviously with COVID-19, health center policy is all students and all staff need to be wearing masks at all times to stop the potential transmission of COVID-19. So you'll be seeing me in a mask over the next series of videos. So what we want to talk about today is acute injuries and how to take care of them. So when we look at acute injuries, the most simple way that we can use is the principle of RICE. When we look at RICE, it's an acronym. A lot of us have heard of it before. The R stands for rest or relative rest. And so what that means is, it doesn't necessarily mean stop doing everything. It means figure out a way to move. So if I'm not able to run, I might be able to bike. If I can't bike, I might be able to run. If I hurt my back, and I typically do yoga, but I can't bend, but I can run, walk, or hike, get out and do that. Movement is really good for multiple different reasons. The I stands for ice, and there's multiple different ways of icing, similar to different ways of moving. So the most simple, ice cubes in a Ziploc, putting it onto the injured area. You really definitely want to protect your skin though, so making sure you have some sort of barrier between the ice pack and your skin. So just a towel or a cloth works great. Frozen peas, frozen corn are amazing. Most of us have that, so in our freezers at home. Definitely recommend making sure that you no longer use it for consumption anymore and it becomes an ice pack and not for food. And then the other ice pack that I often have my patients make, which makes a really great gel ice pack, is a Ziploc. And you're going to take 2 parts water, 1 part rubbing alcohol, if you can find it. A little challenging because I know people are making their own hand sanitizers right now, but it works great. You throw that in the freezer and it makes this great slushy gel type ice pack. Again, still make sure you're protecting the skin underneath. And then the last icing you can do is what's referred to as an ice massage. So if I take an ice cube, wrap it in a flannel, and what I can do is, say I injured my wrist and forearm, I can do 3 or 4 passes. I'm going to dry my skin off, 3 or 4 passes, dry my skin off, and I'm waiting for that skin to go numb. Overall, we want to look at icing 4 to 6 times a day for about 10 or 15 minutes at a time, with the caveat of the ice massage. Because again, the ice is going to help to reduce swelling and help with pain. The C is compression. So compression does a couple of things. It helps to reduce inflammation and also gives the joint a little bit more awareness of where it is in space, so it can help with overall healing. Ace wraps work great, sleeves can work great, but we really want to try to get that swelling down as quickly and easily as we can. The E is elevation. So elevation, obviously trying to get that extremity or get that body part up. If I've sprained my ankle, I don't want to be sitting with my foot hanging in a dependent position. That just increases swelling, increases pain. And again, the goal is to reduce both of those. Swelling and inflammation, swelling/inflammation and pain limits our overall range of motion. It inhibits muscles around the joint. So our early goal in an acute episode of pain or with an acute injury is to reduce both of those as quickly as possible to restore function. Thanks for watching. We'll see you next time.